Janine will tell us when we're going live. Okay, we're now live. It is Monday, July 27th, the last Monday in July. And we are happy to welcome back Kim Parson, a health consultant in the space of health literacy. We want to mention that this segment is brought to you by Exact Sciences, the company that makes the Oncotype DX test. And for women who are in early stage breast cancer, they should be asking about that test because it can determine whether you need or don't need chemotherapy. Their 10-year TAILOR-X study published 2 years ago surveyed 10,000 women, and the efficacy of the study is very strong. So we thank Exact Sciences for helping sponsor our Facebook Live series. So tonight we're going to wrap up our series by questions that all of you sent in, and we thank you for those. I was trying to think of what else I wanted to say, but I think we're just going to start. So this is a really typical one, Kim, and a lot of people ask about this. Can I bring a friend to doctor's appointments to help me remember all the information, or can only family members attend an appointment with me?
Well, thanks, Molly. It's good to be with you again. And so I'll answer that question the way most questions get answered these days, and that's, well, normally it would work one way, but things aren't as normal today. So what I would advise is that you always call the provider, the healthcare provider's office ahead of time, right? And ask them what their policies are right now. Because of COVID-19, I've run into a lot of instances where, people who were even accompanying, minors and people that they needed, felt like they needed to be in the room for, they said, no, our policies right now is, you're leaving at the door, right? So very good right now to make sure you're calling and asking or visiting that office website to say, can I bring a friend? Can I bring a family member? In most cases, previously I've never had any issue with anyone saying, yes, it's okay to bring a friend or a family member. And so if they say that, yes, that's okay, then what you need to do is prep that friend and family member, right? So what are you looking for from them when they go in there with you? So I would, set aside some time for a conversation to say, to list the questions that you have that you want to make sure get answered in that visit. So ask your friend or your family member to be the scribe, to write down whatever that doctor or healthcare provider is saying. That way they're keeping track of all the questions that you have and whether or not the physician is answering them. And then at the end, you can ask, hey, is there anything that's on my list that didn't get addressed, or anything, that you want to read back, right? And let that friend or family member read back, the answers that you were particularly interested in getting. And that way the physician can make sure that they delivered that message in a way that was understandable. And the scribe can, feel confident that they captured that physician's words or directions appropriately. So that really is going to allow you as the patient to focus on what the physician is saying, without worrying about whether you're forgetting to ask for something, or am I going to remember this later, right? And then when the physician is wrapping up the visit, that's when, your friend or family member can either repeat that back or ask. If the physician is giving you the indication that, they're busy, they're out of there, one hand on the door kind of thing, go ahead, if they have limited time, go ahead and ask those questions to the nurse. If the nurse, doesn't feel comfortable confirming something directly to you, they'll go ask the physician and then get back to you, right? You can always, as well, leave questions with the nurse or the physician and ask them to address the questions and either email you or call you later to discuss if there's something that, you didn't get to cover.
So another question would be then follow up to that, because of COVID-19, you may not be able to bring a friend or family member. Would it be okay to ask if you might record this session, the appointment, on your cell phone?
Yeah, I think that whether it was COVID-19 or not, I think it's appropriate to go ahead and ask that. But I do think, in this day and time, that's probably a nice way to approach asking someone about recording is so that you're giving them your reason for why, right? I think sometimes people are concerned about recordings because they're afraid that, you could be litigious or something, right? That there may be some sort of gotcha that you're shooting for there. And if you can just explain, I'm not able to bring someone with me, or COVID means that I'm not allowed to bring someone with me, and I want to record this so that I can listen to it later, you shouldn't have any problems.
So many appointments now are being done via telehealth. So I would think certainly with telehealth, somebody else could be with you as we're together right here on screen. You could have a friend or family member sitting with you. And if that's the case, would you have to provide the physician with a HIPAA allowing this person to be with you?
Yeah. So again, that I would say it's going to vary by, by provider, right? So if you have any questions, and certainly providers, healthcare providers of all types are getting tons of questions right now from people about in-person appointments, about telehealth appointments. And so just call and ask what the policy is. I've done a couple of telehealth visits myself during this time. And I'll have to say that my experience was that the healthcare provider was very proactive in reaching out to me to say, have you ever done telehealth before? Maybe you did it before, but here's how it's working now. And so that would be a good time to ask your questions about that.
Okay. So our next question is, and we've talked about this before, I sometimes find my medication labels difficult to understand after I get home. Who could help me be sure I'm reading it right and using the medication properly?
Yeah, good question. So I would call the pharmacist where the medication was filled or where the prescription was filled, right? And ask them to walk me through how to take the medicine. And it's also good, maybe when you're picking up your prescription, to ask the pharmacy if they have any materials that present their instructions in a different format, right? So pictograms, icons, they could have, additional materials that are available that are, just not that standard thing that they attach, right? And if you ask for it, they may be able to provide that as well. But again, always, if you're picking the prescription up, ask them there. Don't hesitate to call back and speak to someone. If the prescriptions are being mailed to you, just call that customer service number from whatever pharmacy benefit manager that you're using, and they should be able to connect you with a pharmacist or a pharmacist tech that should be able to walk you through that.
Now, some people might have a challenging situation where they're picking up their prescriptions in a drive-through. And I've never done that, but I don't know if the individual who hands you your prescription is a trained pharmacist. And I don't know if they have time, or you can ask a question at that drive-through. What do you suggest in that scenario?
Yep, I would ask the question. Generally, even when I pick mine up through the drive-through, they will generally ask, do you have questions for the pharmacist, right? That should be an indicator that they're open to that. And just as easy for them to send you another sheet that has some pictograms or visuals on it through the drive-through delivery, just the way they're able to do your regular prescription. So I know that particularly a lot of us, right, and particularly certain generations of us, are very hesitant to ask and push for more, right? We see that people are busy. We know that there's someone behind us.
Yes, right.
But when it comes to your health, you need to take the time, right? We know that there's 46% of the people in one test, misread some medication instruction, in the research project that they were doing, right? This is not just necessarily people who, have been determined to have low health literacy. I know when I look at my prescription bottles now, I pay a lot more attention to them than I did maybe 10 years ago, after I understand that, I think I'm taking this correct, but I don't know what I don't know, right? I think that, there are times when, yes, you're trying to be in a hurry and be recognize the people around you and that they're waiting. But I think when it comes to your health, that you slow down. So go slow to go fast, right? Go slow to understand so that you can then, quickly do what it is you're being asked to do.
And one thing I'd like to add is sometimes when you're given a drug in the hospital and then you leave to go home and you have a prescription to take with you, sometimes the hospital dosage may vary from the at-home dosage. So you cannot assume and should not assume that what the amount of the drug and how many times you take it in the hospital is going to be the same that you take it at home. And that's a big mistake that some people make.
Yeah, that's a really good point. And so where you should be able to see that, Molly, is on your discharge instructions, right?
Mhm.
So those are the documents that, as they're moving you out the door, they're having you sign and check and say, this is what you need to do and who you need to call if you have a problem. That those discharge instructions should have, here are the medications you should continue taking and how you should continue taking them. Always, it's good once you've been in the hospital, though, to always follow up with your primary care physician afterwards. Because, what I see is like, okay, so you have your medications that you're taking,
Mhm.
and then you go into the hospital and they likely get altered or things get added there, right? And then to your point, as you leave and come home, so now what is the new normal for me when I go back home? Because it may not necessarily be that same set of instructions and medications that you had prior to going into the hospital. And to your point, not necessarily going to be that same set of medications and instructions or dosing levels, et cetera, as while you were in the hospital.
So I have to tell just a funny family story here. My mother was in the hospital and was discharged, and my husband brought her home, and it said, do this, do this, do that, and it said no alcohol. Somewhere it said no alcohol, but then below that it said resume normal activity. And so she gets home with my husband, and she says, Tom, make us a drink. And he said, Mrs. Drake, look at this. You're not supposed to have any alcohol. And she said, well, look right there. It says resume normal activity. This is my normal activity. Make me a cocktail. So he did as he was instructed. But when it says resume normal activity, discard that, ignore that, and look at what they're actually telling you to or not to do. So your normal activity may not be what your doctor is actually prescribing.
True that. Yeah.
So yeah, that was a good one. My appointment times, here's the next one, are never at times that work for me. Is there a better way to get a different time? Yeah. So I think, I don't know what not works for me mean. Maybe people are employed. Right now, we know so many people are working from home. I know some physicians are having evening and weekend appointments, but that's hard. So what would be a solution to that?
Yeah. So I run into that as well, right? And especially if you're trying to plan for something several weeks or months out, right? How do I know, that it's going to be, I'm going to be good at 1 o'clock in December, right? But so prepare a list of days and times that normally work for you or what you think are best for you, in the coming weeks, if it's a short-term appointment, or that normally work for you, and the longer, if it's going to be an appointment that goes out further. And then that way, when you're having the discussion, you'll have a list right there in front of you, right? So that you can give them the dates that are good, dates and times that are good for you, for them to search for. The other option I would tell you is, we're starting to see more and more physicians' offices have schedules online where you can go and see their availability for appointments. So check that out as well, because then that might allow you to say, oh, okay, he's got, I'm seeing on the list that there are 3 appointments listed there now that, might work for me. Jot those down then, and then have the conversation if you're not comfortable, scheduling online. Or maybe even you don't know if you're going to have a follow-up appointment or not, where you will need another appointment, but you're just trying to be prepared so that when you go into the office for this current appointment, right, if then they want to schedule a follow-up or something else, go ahead, check your schedule, check whatever schedule of theirs that you could find online available to you. And then that way, hopefully you'll have some options that you can get to an appointment at that moment when it's trying to be scheduled, as opposed to I'll have to call you back or they have to call you back, right? Going back and forth.
So with telehealth, this might be another opportunity to schedule something that's more convenient for both you and the physician. So that I would suggest that you ask about, will the physician hold a telehealth appointment for me?
That's good. Ask if that is an option. Another thing that you can do is, so let's say that, none of the times that were good for you, they have available. Let them know if they have a cancellation at that time, right? That you'd like for them to call you back and reschedule for that appointment.
And keep in mind that right now people are either have lots of openings or very few, as people are trying to get in after a period of time where we've all been sequestered. So
Yeah.
patience, unless it's an emergency, is maybe a good thing. So here's a good one. I have trouble filling out medical forms by myself, especially when I'm nervous about my appointment. Can I get those ahead of time?
Yeah, so in most cases, the answer is not only yes, but it's also usually preferred by the physician's office, right? And especially as you say, during this time when it's COVID, so they want to have as few people maybe in their waiting rooms as possible for as short a period of time as possible. Now, some offices may have gone to, capturing that information electronically via tablets and that sort of thing. In those instances, that might be hard. But again, call, right? Never be afraid to ask the question. They can always, the answer can always be no, right? But that's no knock on you because you asked the question, right? You're just seeking some information. So yeah, call them, ask them. Usually in most cases for me, people will send me that information maybe 2 or 3 days ahead of time, because usually it is several forms like whoever asked the question posed. That gives you some time to be thorough in your answers, but it also, gives you time to get anybody else that you'd like to take a look at those forms and help you answer them.
Okay. I have to apologize if I wave this Hallmark envelope. It's because I'm having a hot flash. And I don't have a fan, so I'm very sorry, but I'm melting here. Okay. Language barriers. This is a big one. Often people don't understand the doctor's orders or the treatment. So let's say English is not your first language. Mm-hmm. And they don't have somebody in the office who speaks whatever your first language is. How would one handle that?
Yeah. So any, current law is any organization that receives Medicare or Medicaid reimbursement, federal health programs, they are obligated to provide language access services to people with limited English proficiency, the deaf, the hard of hearing, right? And all 50 states now have language access laws as well. So visit the healthcare provider's website or call to request. So you're going to need to make these arrangements ahead of time, right? So, lots of people are using interpreter services, right? And so, they're going to need to know that, I'm coming in and, this is the language assistance that I need, right? Someone that speaks Spanish or, someone that speaks Italian, whatever it is, right? You'd be surprised. I know in Albany, New York, the health systems there, there are over 100 languages that provide language interpreter services for. Okay. And I'm sure that is very much the case in many areas across the country that they're at that level, right, in terms of the number of languages that they need to provide interpreters for. You shouldn't have any trouble finding that. If they don't have an interpreter that will be available at the time, of your appointment, then that's something that they will do is adjust the appointment so that the interpreter can be available.
So how exactly does that work? Is the interpreter actually physically there, or is that done through a Zoom? So they actually have over 100 people in Albany, New York, who have different language abilities.
They have people that interpret over 100 different languages.
That's amazing.
Yes. So I don't know how many, I can't tell you how many actual people that they have.
Right. Okay. But
But
100 languages is a lot for a small town like Albany.
yeah, yeah, yeah.
Wow. So just to rehash this, so if they take Medicare or Medicaid,
Yeah, if they take money from Medicare or Medicaid,
they must have someone
it is,
available to
yeah,
interpret for you.
it is a federal requirement that they apply that. But again, all 50 states have language access laws as well, right? So, and again, if a physician, or if they're in a practice where they, or a group, right, where let's say you're a commercial patient, right? But they're still taking money, Medicaid, and Medicare money. That means they have those interpreter services available, and it should be available for anyone.
Okay, so to explain that again, so let's say you have an employer insurance, but you have a language barrier. Because the provider accepts Medicare or Medicaid money, you will have an interpreter available to you.
Yes, they should have an interpreter available, and which should be able to work with you.
And this is also for the deaf, for somebody who would sign.
So yes, so deaf, hard of hearing, yes.
What about the blind, those who can't see?
In that instance, I don't know. I don't know if what the particulars are in terms of providing documentation, either in some sort of verbal format or in, a Braille type format. I'm not sure about that. So in that instance, I would just direct the person to seek out information, maybe from the physician's office itself.
Okay. All right. Good answer. So
yeah, I do want to jump, because there were a couple of other questions that were asked, but they were clinical in nature.
Yes, I know. we can't talk about those. But we should talk about, if you have a question that is clinical in nature, you really need to go back to your treating physician, oncologist, nurse navigator, patient navigator for those questions.
Yeah, that's exactly what I was going to say. So I'm not your resource for that, but there are resources there. Again, go back to, if your hesitation to talk to the physician, to say, help me, I'm not there. I'd like for you to sit down and walk me through this again, or I'd like to repeat this back to you. I'd like to, to do, then sit down, with the nurse to do that. If not, ask about a patient navigator, right? As someone who might be able to do that with you as well, to help facilitate that conversation.
So right now, Kim, as we're still in this really fluid, unprecedented time of COVID, what are some of the hot topics that are coming up, that you're faced with people are asking you in general?
I think what I would say, Molly, is that the questions, now are similar in nature to the, well, can I take somebody with me now? Right. So again, there's a lot of process type questions, right, where people are trying to understand. And so, I understand that, because the process is a difficult one in normal times, right? Because, every physician's office, every practice, may have front office practices that are different, back office practices that are different. And so, really my advice is the same now as it always is. And that is, just do not be afraid to ask questions. These are people that are, yes, they are providing a service to you, right? And you are paying for that service. And their goal in providing that service is, to diagnose you and to help provide the information that they feel as they diagnose you and treat you, to help move you down the path to better health, right? So that's their goal. They may seem like they're rushed, right? But when I think that if you actually just feel confident and asking the question, and that you're going to find that most people are going to be willing to take the time to walk you through that, or to find, if they don't have the answer, or they don't have the time, to find the right resource to do that for you.
So I have one question from me. So often I will book an appointment and I book an appointment for 8:15 for one physician, and I arrive and there are 3 other people there, but the office opened at 8:15. So I've asked, how many patients did you book for 8:15? Knowing that often there are cancellations and that time goes wasted and you can't bill for it. So how do you ask about that? Because right now, for me, if I have to go to the doctor, I want to be the first appointment of the day. I want to be there before anybody else is there, but staff and the physician, and then I want to get out.
So what I would encourage you to do, Molly, is ask questions about things that you can control, right? So whatever their process is in terms of how many people they schedule at 8:15, just because they tell you 3 and you say, oh, well, then I'm going to be stuck waiting. I'm going to wait. That's not going to work, right? They're not going to reduce it to 2 or 1. What you can do though is say, you've got multiple patients scheduled at 8:15, right? So what I need you to do is to let me know, when if my appointment is at 8:15, when should I expect to be called back, right?
Oh, that'd be hard.
They should be able to answer that question no matter how many people they have scheduled at 8:15, right? They should be able to tell you your appointment's at 8:15, but you can expect this amount of time in our waiting room. And then when you get past the waiting room, right, and then you're in the room waiting for the physician, what is my wait time going to be there? And then that can allow you to better, plan or to negotiate with them, right? In terms of, okay, I get that my appointment's at 8:15, but it's going to be 9 o'clock before I actually see the physician. I actually have a hard stop at 9:30 because of another appointment. Is there a way to make me, the first patient that the physician sees, for the 8:15 appointment?
And that's really good advice for an individual who's employed and is taking time away from work that's unpaid.
Yes.
So we just got about 3 minutes left. Is there anything else you want to share? Perhaps you could tell us again about the United Healthcare site.
Yes. Yeah. So always want to point you to resources, helpful resources. Just Plain Clear. JustPlainClear.com is United Healthcare's glossary and includes health terms, insurance terms. So very good resource for you there. And then also the National Academy of Medicine Roundtable on Health Literacy as a site that is just full of papers, recordings of presentations, workshops that have been had on subjects as diverse as how is health literacy, how does that impact people when they take medications? How does it impact people in the cancer arena? So multiple different subjects that you could look up and find other resources there if you're more interested.
Okay, well, Kim, thank you so much for making yourself available. And should you have any further questions, you can send them to info@thepinkfund.org and we can pass them along to Kim and reply via email. And again, we want to thank Exact Sciences, the maker of the Oncotype DX for breast and prostate health, and Cologuard for colon health for sponsoring this series. Good night and have a great week, everybody.
Thanks so much.
Bye-bye.
Bye, Molly.